The SAGES studies, SAGES stands for Successful Aging After Elective Surgery. And we started the first data collection on our first cohort in 2010. And so you can see it's been underway for 12 years now. Our first cohort, we enrolled 560 older adults who were undergoing a major surgery. They had to be admitted to the hospital for at least 2 days, preferably 3, and undergoing a major surgical procedure that was not cardiac or neuro. So many of them were orthopedic, vascular, or general surgical procedures. All of these patients had no dementia at baseline, ruled out by clinical assessment and neuropsychological testing. And the goal of the study was to look at risk factors and long-term outcomes. And we wanted to see if delirium indeed was associated with long-term cognitive decline. And we did publish our first major study out of SAGES 1 in 2016 in Alzheimer's dementia. And we did show that at 36 months, the patients who developed delirium did have a substantially and significantly accelerated trajectory of cognitive decline at 3 years. We have just finished our initial enrollment for SAGES 2, which has been underway since 2019. And unfortunately, that study, as you can tell by the year, was delayed by COVID-19 when elective surgeries were shut down for a lot of the time of COVID-19. And so we have caught up on our enrollment, and we just completed it, but we're really just starting the long-term follow-up stage now. We're hoping, because of the delay, we're hoping we can get all patients out to 18 months, hopefully out to 24 months. We won't be able to achieve the 36 months because of the delay, pretty much a year we lost due to COVID. In that study, very similar enrollment criteria to SAGES 1, but we required spinal anesthesia. And so the vast majority of patients are orthopedic patients undergoing knee and hip replacement under spinal anesthesia. The advantage of having the spinal is that we have cerebrospinal fluid samples on over 70% of the cohort. And so it's really great, and it enables us to look at CSF biomarkers. The goal of SAGES 2 is to look at innovative biomarkers, such as from CSF. We're also doing advanced imaging studies, functional MRI, diffusion MRI, arterial spin labeling. We are also doing electrophysiologic measures on a subgroup and TMS stimulation approaches. And so we're able to look at these novel biomarkers in SAGES 2 now that we didn't have before. I think it's going to be very exciting. I think we'll have answers about delirium, and I'm hoping we can get to that long-term cognitive decline as well.